Everyone. Just wanted to get to you on a few things. First, a little review of some of our topics last week, and then talk about the quiz. So, first, a brief review. Just want to make sure that you're clear on some of the topics. Really, just a brief review from what we went over last week or what was included in our materials. In the text we talked about policy formation, and we didn't really have a lot of work kind of surrounding that policy formation stuff. So chapter 3 we kind of talked in general about the process of policy formation, development through the different branches. Talk a lot more about that in chapter 6, but so 3 kind of set the stage for that health policy formation. And chapter 5 talked a lot about setting the health policy agenda. So it really focused on the external environment around the health policy agenda, talking about like research and analysis, which should go into the health policy agenda. And you think a lot about now, so currently, and the health policy, health reform agenda. And it really, you think about the research and analysis that needs to go into that, and how is that being done? Who is doing that research and analysis on behalf of the current administration, and how is that getting done? So that's always an interesting item to consider, and all of that research and analysis process, very, very important. 2 other big pieces from the research or from the agenda setting section that I wanted to talk about: lobbying. So lobbyists are very, very important. Having been in the kind of on the health information management side in education for quite some time, the lobbying efforts of the American Medical Association, the American Hospital Association are incredibly strong. So if there is an element of the rules that they do not like, so for example, HIPAA or ICD-10 or something of that nature, if there's an element of that those organizations do not like from a regulatory perspective, their ability to rally against that is amazing. The lobbying efforts are very, very strong. And American Health Information Management Association, also very strong entity to rally against particular rules, regulations, and even laws. If especially the AMA and the AHA, they can really get a good effort going to get out there and contact your congressmen and your senators, and get some support for or against particular legislation. And speaking of that, the political aspects. So politics going into setting agendas. So there's always, especially looking at the secondary article that we had with regard to health policy this week, and then talking in chapter 5 of our text about the politics of agendas for legislation. So it's not always about what does the research say and what is good from an analytical standpoint, but also from a political standpoint, what is good for my community, my constituency, what is not good for them, and what is good for my political career, and what do I want to have going forward. That's an unfortunate side effect of just the nature of politics. So that happens too, and we have to deal with that, unfortunately, in the healthcare industry. Chapter 6 talked about the development of legislation. So that chapter reminds me of, and I know a lot of you are much younger than I, but I know it's kind of a throwback, so maybe as a throwback you'll be familiar with this, but there used to be a Schoolhouse Rock video. it used to play when I was a kid on Saturday morning cartoons called, I'm a Bill on Capitol Hill. It was a song, it was a little cartoon, and that's what Chapter 6 reminds me of. If you've never seen it, it's kind of a cute thing. If you've got kids, great way to teach them about the legislative process, and that's what Chapter 6 reminds me of. It kind of is a layperson's description of the legislative process. Chapter 6, not such a layperson's description. It's a little more complex, but that's what Chapter 6 really talked about. So that was a little detail of kind of some of the stuff from the text and the readings. Important to go through that if you haven't. I would, make sure that you did. I know that sometimes if you're not being specifically tested on it or looked at, if it's not part of an assignment, it's easy to skip through that, but that's an important piece of this course. We did talk about narrow networks in our discussion board, and that was great discussion. Good job. Narrow networks are an unfortunate side effect of the ACA, but narrow networks, as we talked about in the boards, have existed for a very long time. And someone had mentioned, the VA is a really great example of a narrow network, but also HMOs, they were kind of one of the original commercial narrow networks. There's so many examples of it. I do, here in the Pittsburgh region, we do have these, kind of pseudo-narrow networks. They're quite narrow, but very deep of providers with UPMC. And actually the Highmark network is is not as narrow because you do have access, depending on your plan. If you are a commercial member of the Highmark plans, you typically have access to the Blue Cross and Blue Shield network. If you were a previous member, I realize that Highmark, I don't think that they are part of the exchange plans any longer. I think UPMC, I'm pretty sure that's what I've seen, is the exchange provider in this area now, but I could be wrong about that. But the issue is that, when you have UPMC, you're kind of locked into that. So there are many UPMC providers, but they're UPMC providers. It's kind of a narrow but very deep network. So it's an interesting problem to have. You have many providers in a fairly limited area. If you were to get outside of the region or the state. I know that they do have access to some other networks for some people involved in the UPMC health plan, such as MultiPlan, or there's another network in Ohio. But it's still somewhat of a narrow network. So great job on our discussion. Really interesting information some folks brought to light there with regard to narrow networks. So let's talk about our quiz. So with our quiz, it was really, the point of having this, kind of short, timed quiz was really for purposes of recall. So many folks did really well on it, but I did want to go over. I have 3 questions that I wanted to go over that were missed more frequently than others. They were the ones that were missed. So. Unfortunately, I have them out of order now. So I'm going to grab this one up here first. So the first question was, which of the following was not one of the suggested public policies that could be pursued to put diagnosis errors on the public policy agenda? So this was from last week, and it was from the brief with regard to diagnostic errors. So in that brief, it talked about many different areas that could be pursued with regard to diagnosis errors. There were enhanced Medicare conditions of participation, quality improvement, collaboration, follow-up, feedback, medical malpractice reform, payment reform, medical education reform, improved technology and electronic health records, enhanced research, So there were several areas, but the one area that was not mentioned was insurance market expansion. So insurance market expansion was not mentioned, and so that was the one that was the appropriate answer in this case. So that is our answer. And when you think about this, there are uh, there are lots of ways that we could address this, but the main way is really to address um, making it a making it a priority. We either make it a priority through the Medicare conditions of participation, where it's a priority for hospitals um, and other uh, participating providers through Medicare, be it um, an ambulatory surgical center or anyone that participates through the conditions of participation, making it a priority for them to be sure that they're accurate in their diagnosis coding, or we make it a priority in medical education to be sure that those that are learning, be it coders, be it physicians, be it non-physician practitioners, that they are learning accurately to document and for coders to code accurately. I mean, there's a multitude of ways to address this issue, but in any case, it's really about making it a priority. And as we move forward and have diagnoses be even more important. They've always been important to reimbursement through the DRG reimbursement system. It's driven by the diagnosis. But as we have more of that through risk-based reimbursement, which is the way that Medicare Advantage plans are paid, and the way that many other plans, many Medicaid plans are going to that. So it's very, very important that we're dealing with diagnoses appropriately through documentation as well as coding. Second one, which of the following is not considered a theory of policy change? This was a reading from this week. This was discussed in there. The garbage can model, punctuated equilibrium, and advocacy coalition framework. These were all elements that were within theories of policy change. It was in that Weissert and Weissert reading, which was the extra reading that was at the top about policy change. Great article. Hopefully you took a look at it. I think probably most people did. But if you haven't taken the time to take a look at that, I would advise reading through a really neat article about policy, development of policy, etc. And at the very bottom, the last section of that, it talks about theory of policy change. So as opposed to the kind of the true active elements of it, kind of taking a theoretical standpoint. The correct answer in this case was stakeholder status quo. That was not noted as a theory of policy change. So that is our answer there. And then our last question that we'll talk about, which of the following is not regarded as a stage of the policy-making process? So policy formulation, policy implementation, policy modification, and policy measurement. So this is really kind of comes from our textbook as we look at the policy-making process through our textbook reading for this week. And it's interesting because, as we've learned a lot through our coursework in this program, we kind of think about the process improvement cycle and how important measurement is to any type of a development of any type of a new process, new innovation, etc. However, unfortunately, in the policy world, measurement is not part of that, because in the policy making world, we formulate and then it's that policy is formulated, and then that's kind of where it ends. You may have some implementation, There may be modifications based on administrative standards, but the measurement really does not come into play through that policy making process. There may be measurements made through other administrative channels. For example, the Agency for Healthcare Research and Quality may be involved in policy measurement. CMS does various policy measurements. There may be other types of agencies that are involved in policy measurement. However, it's not part of that policy making process. You're really just kind of formulating policy, making implementations via regulation, because typically when a law is created, you'll have your legislative process, you'll create a law, and then typically regulations need to be developed to implement that law. So it's a very kind of convoluted process that whole system goes through. So there's really not a measurement phase like we would see perhaps in if we put a policy in place in a hospital where we may measure the effectiveness of that policy, et cetera. So in the legal world or in the health policy world, we don't actually do measurement as part of the policy making process. So that is our week 3 feedback. If you haven't already, please take a look at your email, your RMU email. You got an email from me regarding scheduling for a Google Hangout. We're looking to get a Google Hangout together to go over some HIPAA case studies. Should be an interesting discussion. Kind of go over some scenarios and examine what we might do in different situations. So please respond to that. I know it's summer, but this is part of our program. We try and do one of these each term. So please respond to that email if you haven't already. I got a ton of responses, so I appreciate your response if you have. And any questions, please let me know. And looking forward to a great week. Thanks so much.